A standard drink you can think of in terms of the solo cup, which is the most traditional manner that most people are used to looking at it, and the different lines of the solo cup being a different product of alcohol. So the lowest line being more with the ounce, like with hard alcohol, and then the next one with wine, and the final highest line with beer as the standard drink. The difference also, to consider is how much alcohol is in each amount of drink. So, a beer is actually going to have only about 7% of alcohol, while wine will have higher, like 14% of alcohol. And generally, every time one drink you have, you're going to end up with having about an hour to digest it and breaking down. And that process generally can't be speeded up as well. So if you have 5 drinks, it'll take 5 hours to come out of the system. In your stomach, it gets absorbed, and then in the liver is where it ends up being processed after. When having alcohol in general, if you're eating a full meal with it, it will take longer to digest, and the feelings from the alcohol, in terms of the high you get from the alcohol, will take a little bit more time. The other side effect, though, is of course dehydration with alcohol, and so someone who has a hangover the next day with a headache, it can be reduced by having pretty much one drink and then follow that with 1 glass of water to keep up with the dehydration. So understanding what a drink is will help you understand how much your patient is actually drinking. So, letting the patient know what you're defining each level of, straight alcohol, wine, or beer will help to understand how much they're actually drinking a week or a day. With pregnancy, there is no safe level, so no amount is actually considered okay.